Of Huntington's Hospital. My name is Danielle McPherson, and I'm a supervisor for the Crisis Prevention Institute. It has been called to my attention that within the past 10 days, there has been an incident at your hospital involving an altercation between a pharmacist and a psychiatric patient that turned violent. I am speaking to you all as employees of Huntington's Hospital in hopes of mitigating this issue and providing the proper guidelines to implement protocol in case the situation does arise again. First, each of you should be retrained in these procedures by January 1st, 2017, as well as once annually thereafter. Proper training can provide you with the structure necessary to prevent such a situation from arising again. It can also teach you to act appropriately when you encounter a patient who is being violent. It is crucial that you are all trained, not just solely the crisis prevention team and the hospital security staff. If you respond appropriately to aggressive patients, the crisis prevention team may not even be needed at all. But if you respond inappropriately, it may worsen the patient's behavior, thus escalating the situation rather than diffusing it. Secondly, training the staff must not be the only means of resolving such an issue. You must all be properly trained in conjunction with reinforcing the values, vision, and mission of the hospital as a whole. Knowing what you stand for and what type of care you strive to provide to patients is crucial to keep in mind when professionally handling a situation such as this. Standards regarding the use of physical restraint in clinical settings have been provided to you and will be reinforced by the upper management of your hospital. You will all be properly trained to know when patient restraint is necessary, when it's not, and how to minimize the risks associated with restraint. Physical restraint should never be used to inflict harm on the patient, nor should it be used as a method of punishment. Lastly, what was forgotten by the hospital staff after this event occurred was the importance of debriefing. After a situation such as this arises, a session should follow in which all staff can openly discuss exactly what happened and how it was handled. Communication is vital. One should not ignore that an event occurred. It happened and it must be talked about. The purpose of debriefing is not to point fingers at anyone, but rather to make improvements for preventing the situation from arising again. Please refer to the link that follows this video conference to sign up for one of the training sessions that are available to you. Your management requires that each and every one of you attend one of the training sessions prior to the 1st of January. The hospital-wide protocol for patient restraint is also available through this website, and it will be discussed extensively in your training sessions. Thank you all for your time, and I have emailed you my contact information, so please do not hesitate to contact me if you have any questions or concerns. Thank you again.